produce. Okay.
All right. Well, hello, Dr. Q. I understand you're running for SVMH Board of Directors for Zone 4.
Yes.
So while other candidates are out there campaigning, raising funds, instead you're in here with us giving seminars regarding anxiety and depression, healthy living, and achieving financial freedom. So why exactly are you not out campaigning to raise funds and instead in here speaking with us?
Well, I guess the main reason why is that it's an altruistic reason why we're running for office is so that we can serve. Well, it's very self-serving. We go out there and just asking for money and donations, and then all of a sudden, then all it does is just gonna propel the whole stigma that politician, not just politician. So what we do is that we'll make sure that we do what is true and important for society. So what is important? Well, during the pandemic, one of the biggest problems that we see is anxiety, depression, and people get isolated. So that's part one. Part two is a lot of people have a lot of medical conditions and they don't get better and they don't take care of themselves. And then of course they're at a higher risk to have infections, and then there's people that actually die from them, as most of us actually know some of those folks. And then number three is that then what else can we do to help ourselves? And I think the important thing is financial freedom, because I think a lot of us, whether we like or not, in the capitalistic society that we live in, we just never make enough money because it's always, expensive things, expensive how, expensive whatever. And so we're chasing after the rainbow all the time. We'll never get there. So the trick is, well, how do you actually get to the point that you can do whatever you want, whenever you want? And that would be financial freedom. And it's kind of funny because I hang out with a lot of nurses at SVMH, and people, and the non-nurses staff, and they said, wow, I'm 15 months from retirement. I was like, wow, that's kind of sad. Why do you have to count down like that? I don't want to count down. I want to work until I drop dead. And so it's not how much you work. So once you achieve financial freedom, then you get to decide, well, I only want to work half time. I want to work a quarter time, 1 day a week, 3 days a week, doesn't matter what. But that's going to actually give you the ability and the flexibility in life. And I think that's really the important thing. So that's sort of like the way. So the way to actually achieve it is to address medical issue, keep yourself healthy, and then take good care of your finances. So that way then you'll be able to achieve that healthy living and the sense of health, happiness, and healthy lives. I guess that's the reason why.
Okay, great. Yeah, we often hear that financial stress is one of the greatest stressors,
Right.
which brings me to the next question. What exactly is stress?
Yeah, stress basically is just something that, you just feel them, right? Most of us say, well, stress, and everyone's like, yeah, I know what stress is. And sure, you can get the textbook DSM-4 and say, wow, stress is that, you feel the sense of, irritation, lack of sleep, and, all of that. But at the end of the day, it's actually very organic. We see stress when we feel it, and it is just basically a sense of being overwhelmed. I think that's really the important thing. We are out of balance of our homeostasis. And I think the important thing is whenever we get to that point, we need to realize it. Unfortunately, a lot of us let stress consume us, and then we become a part of the problem a lot of time, because when we get stressed out, guess what we want to do? We actually want to destroy ourselves, consume different kind of substances to do that. But even worse, you hear about misery loves company, right? So then all of a sudden now we want to hang with people and just have these sessions with co-workers or friends and family and just talk about how terrible it is. So now not only you get stressful situations, stressful life, stressful finances, or medical issue, now you actually double and triple it because you go and talk to this friend and that family member, another family member. So then all of a sudden it becomes repeated. And in many ways, it's very similar to our TV system right now, where you have one fire at some location, and then now it becomes 3 fires because you hear this morning, afternoon, and dinner time. So that's why I told everyone you need to recognize it and then address it. It's not the stress that actually kills you, it's what you let the stress do to you. And I think that's really the important thing.
Absolutely. And I love what you pointed out about awareness too, because I think that's part of the solution is starting to gain that awareness.
Yeah.
Okay, great. And then these are some questions that have come from your practice. So you tell me that I should be the best doctor in the house, but I'm so depressed and anxious all the time. How do I even get to that point of being able to be the best doctor in the house for myself and my family?
Yeah, and I think that's a very common question people usually have is that, oh my God, you're the best doctor in the house. You should know your body well. You should feel your stress, your anxiety, depression, your diabetes, hypertension, whatever. The problem is sometimes you're so consumed in it, it's almost impossible. So whenever you found yourself in that kind of situation, I think it's really important to kind of take a step backward, hit the pause button. It's like a hamster running on the wheel, right? I mean, you keep running, you run fast and fast and fast, and you expect to go somewhere. Well, guess what? You just commit the act of insanity. You're literally just like doing the same thing, expect different results. So I think the things to do is, well, just get off the wheel, see what's going on. Is whatever that I'm doing even that meaningful? When your plate is so full, you can't even see where the issues and problem is. So usually the term I use is that, well, just line up the load. So just let go a lot of these things. So things you don't need to do, materialistic stuff, kind of negativism from friends and family, people that just kind of suck the life out of you, then just kind of stay away from them. You don't have to like disown them, but just stay away from them, and then all of a sudden they'll be able to, you have a little more sense of clarity. Second is just a sense of most of us already possess sort of like an internal knowledge of what needs to be done. But so many of us, we actually so much in denial. So then we say, oh, well, I need to do whatever because. Well, maybe the things to do is, well, do I really need to do whatever that is? And if I don't, then just go for it. So then the big question people have is, well, how do I know I make the right decision to let go of a certain thing? And the answer is, once you analyze it and you let go of a certain thing, and then the next day or the next week, they say, oh man, if I should have done that a month, 2 months, 3 months ago, that means you made the right decision, because obviously your body just waiting for you to make that decision, but you are so much in denial and you didn't, so that's why.
Okay, great. And then for those of us who may be suffering from depression, anxiety, what do you say about medication?
Yeah, so medication is reasonable. I think the important thing about any medication is to use for specific purpose. So whenever you talk to any of your healthcare providers, including psychiatrists and primary care doctor, always ask the question, why? Why am I taking this? First question. Second question is, how long do I take it for? And the third question is, when do I stop it? So don't just take it forever. Of course, the drug company want you to take forever, and they brainwash most of us in healthcare. Just take more stuff forever. Take Prozac forever, take Celexa forever, take whatever forever, statin forever. The point is that all of that is going to accumulate a lot of toxin in your body, and then your body become toxic. And then what happens next. We have to take another medication to counteract that toxin effect and the side effect that they talked about. So the things to do is, well, less is actually better, but you have specific purpose. So in many ways, I want people to look at medication as sort of like antibiotics. So just take it for a specific period of time. Now, if you get really bad infection, you take a longer, and you don't, you take a shorter course. So if you do it like that, you do a lot better. So while you're taking the medication, then you say, what do I do at this point in time in order to better myself, to address the stressor in my life? So it's always important to start with the why. Why am I having stress? Was I always like this, or was it just something happened? So for example, today I have this 19-year-old lady that come in, and she said, well, I'm normally fine, I feel normal. And then she lost a baby, and then she's separate from her partner, and now she's like got terrible anxiety and panic attack. So she was never born with that. It's only the situation that actually caused the problem. So then we talk about why, and we talk about how to address that. And once you actually become cognizant about your problem, it gets better and better.
Okay, so it sounds like using the medication as a way to find the time and the space to find the correct tools to address the underlying issue.
Exactly. And I think the second part of medication is, the other medication is time off. So, if you on that, on the hamster wheel and just keep running, you never get better. So not only you take medication, you should just ask your doctor, say, well, I need to get a week to week, a month off, or whatever. So then you can stop all of that, and then you have a little more sense of clarity in your mind and how to deal whatever the stress are going on with your life, right?
Yeah, I love that advice. And how about natural remedies to help instead of relying on more pharmaceutical medications?
Right. So there's a lot of, self-help product and that kind of thing. You see it all over. You see it cost or see it online. So the big question, well, how do I know it works for me or not? And I tell everybody, whatever that I suggest to you or whatever that your friends and family suggest to you, number one, you want to try whatever that is for 1 month. So 3 to 4 weeks. Okay. And then pay attention. Go back to the whole idea about the best doctor in the house is you. So then pay attention. Does it make any difference? If you get better, you get the improvement that you're looking for, then continue with that. The trick is don't try like 3 things at the same time. So you talk to 3 friends and you're going to take all 3 different supplements. Well, how do you know they work or not? Most of the time you have no idea. And then your cupboard is going to get bigger and bigger because now you have a whole bag full of stuff and you have no idea what works or not, right? And then people now take a whole handful of the stuff. All that does is waste a lot of money, but at the same time, all of the extra stuff in those supplements also can accumulate when you take too much of them. So the point is find out what works for you and use that. Things that don't work for you or doesn't give you that desirable result, then just don't use it anymore because it might be good for your neighbor, but it might not be good for you. And then that's really the important.
Yeah, that's really great advice. Thank you. And we all keep hearing about we should meditate to relieve stress and anxiety, but what about if every time we try our mind just wanders? How do we address that?
Yeah, I think that's a big common thing. There's a important kind of like a physician that champion on that, Deepak Chopra, and he always come out. The first thing is that people come out and ask the question, and he said, just meditate. Like it's driving me crazy. Like, how are you gonna meditate when you have so many things running in your mind and things are racing? So what you need is calmness, and calmness means that you have less life distraction. I think we get so much life distraction that makes it so difficult. For example, you're driving around, you have a whole bunch of kids yelling at you, and one of this and one of that. Well, next thing you know, you're going to miss a whole bunch of turns, and then you actually, get into accidents and kind of thing. So then the things to do is do less, much less. My favorite thing is to advise people, especially we live here in Monterey area, just go take a walk at the beach. So I tell them that, well, just for example, another lady actually got terrible depression, go through separation issues and problems. I said, well, do I call walking meditation. Nothing magical about it. Wear some short, walk into the water. There's 2 important things. One is grounding, so then that way you let go all these electrons stuck into your body because all the wireless stuff that we have. So that actually excite your particles in your body. And then part 2 is when you walk, then of course all the waves are coming at you. So guess what? You're not going to mess around. You're going to pay attention and be there 100%. And so when you're there 100%, then you'll be able to focus on that clarity in your mind. So the second question I tell them is as they do that, they automatically do like a meditation kind of walk. So don't turn on the phone, don't put on the earpod and that kind of thing. So then that way, then you won't have those kind of noise distraction. Enjoy nature and be in touch with your inner self. When you're in touch with your inner self, then you'll be able to know exactly what needs to be done for that individual, which is yourself.
Okay, so it sounds like it's about learning to be present and that it doesn't have to be something where you sit still.
Right.
The movement may actually facilitate that
right.
process.
Yeah, and it's just sitting around and try to close your eye. I think that's the worst thing because only a monk or the Zen master can do that. Regular people, including me, my mind just racing all the time. I'll never be able to do that. So I need to do something that actually is going to help to facilitate me to do that more effectively, right?
Okay, great advice. So what about people who might be hesitant to talk to family and friends because they're afraid they might be judged? What advice would you give for them about that?
Yeah, so I think a lot of us, we go through life, we always worry, well, what do people think? Well, the problem is if you're constantly thinking it like that, then guess what? You only present a fake you. It's not the real you. Going back to that 19-year-old that I was just talking about earlier, I advise, well, just throw it out there. Just give your real kind of issues and problems, just be the real yourself, because the only person that you can be authentic is yourself. So why put out the fake you? Because eventually people is going to actually discover the real you, and then they might change their mind about you. And so then maybe the number of people that are quote unquote your friend might be shrinking down to 25% instead of 100%. But you know something? The other 75% is not worth it anyway, because they're not going to like the real you. So yeah, don't worry about them. Just move right along. And then you can live your life to the fullest extent, and you not always constantly have to fit in certain mold and meet someone else's expectation. See, the danger is that if you keep doing that, then what if one of these days that person don't like you anymore or don't admire you anymore? Well, are you going to be a nobody? Well, of course not. You shouldn't be. You should love yourself first. The only person should be the best friend and confident is you yourself. So that actually goes back to the second exercise I usually have people do, is that when people go through a lot of problem with relationship and work and whatever, have a lot of self-doubt with anxiety and depression, I said need to do only 2 exercises. Number 1 is called the mirror exercise. So before they go to sleep, say, oh, good night, so-and-so, and then smile at that person, embrace that person. First thing in the morning, same thing. So the next thing you know, you really love that person in the mirror. And it's kind of funny because, you know, we have plenty of patients that just come through very well put together looking, except insiders. And a lot of these, you know, folks don't even want to see themselves in the mirror. Number 2 is called writing exercise. Unfortunately, we have so much of abuse going on. It could be physical abuse, could be mental abuse, could be sexual abuse. There's so much of that going on in this day and age. And a lot of these folks actually carry a tremendous sense of guilt. They feel that they are the cause of the problem. And then not only they get abused during the time they went through, but now they get repeated abuse in their brain because they're constantly thinking about, they are the cause of the problem. So then the second part is called writing exercise. So you do the writing exercise, whatever the thought that comes to your mind. Instead of writing a journal, I have them write on a piece of paper. It could be unethical, illegal, immoral, whatever, just write them all down. And then tear up, burn up, flush down the toilet. So no one need to read it, but you need to let it out. Because if you don't, it's going to just bottle up inside. And then eventually you're going to have an internal explosion, which is, you know, anxiety, depression, which is bad for you, or external explosion, which is all the road rage and people killing people, and that's bad too. So either way is going to be good. So just let out those sorrow and those emotions, so then people can start the healing process.
Yeah, it sounds like the more we keep it in, the more we actually create that stress that continues on and escalates.
Yeah, and you know, just like anything else is, you know, just rotten inside. And the longer you wait, the more rotten it is. And no wonder it's just a terrible situation, right?
Yeah. So it's having that awareness sooner so that we cannot have it escalate to that level. Okay.
Yeah.
So let's go to people who maybe have been really good about keeping social distance during COVID, and now people are getting back out in the world, and they're finding that they're finding that they're experiencing terrible anxiety, finding that other people are being more relaxed than they're comfortable with. How do we ease ourselves into going back into a more open society and still feeling well and comfortable?
So that's one of the common situations. I have patients coming in, and you know, this lady basically 55, 56 years old, doesn't go anywhere, just only come to the clinic to see me and then go home. She didn't stop anywhere, didn't do anything. And then now everything opened up and she's scared to death, you know, she didn't want to go anywhere. And I said, well, that's natural and that's reasonable. So then the question is, just like being cognizant of what you have, then be cognizant, and then how do you manage it? And I think it's really important about, it's not about what you have, it's about how to manage it well. So for her, the management is really simple. Well, just take baby steps. So don't go out there and start to go in there and put yourself at risk because you don't feel comfortable. So they just start something simple, you know, go to the park or something a little more open. Keep your mask on. I don't care what people do, just keep your mask on, keep yourself safe. And then of course, the way that people get infected is, you know, stuff that you put in your mouth, your nose, and that kind of thing. So then, you know, before you eat food, just, you know, go out and about, wash your hand thoroughly, and then, you know, your food's gonna be well prepared. And that will be it. So do the same kind of barrier technique in order to reduce the risk for infection. But don't let society dictate what you should or shouldn't do, because you should do what's comfortable for you, and then you can do more as you go. But it's always good to be careful. I mean, how many times at the beginning of the whole COVID pandemic, oh, well, you don't need to do this, you don't need to do that, oh, it's in China, don't worry about it. Well, guess what? It's all good. Everything is always fine in life until it's not fine. So let's just, so it's okay. You can never be too careful. And the second part about those folks is that, well, if you worry about something, then test it. For example, I have this lady in her 50s with type 1 diabetes, 7-year-old. She's exhausted, just moved back from Southern California. Her parents live right here in town, want to help. She said no. Why? Well, she didn't want the parents to give COVID to the kid because the kid has, diabetes. So I said, well, you worry, but you really need some help, right? So, okay, I need some help. Well, then establish guideline how to keep it safe. Well, the parents retire, they're older, they don't go a lot of places. But if you worry, well, what else can you do to help to address that? And one of those is frequent testing. Just like our clinic during the pandemic, we have people get tested all the time, our providers. So once a week testing. Then make sure that they're always negative. And then whenever they have any symptom, then do additional tests. When they have any potential symptom, it's a little cough or maybe a little bit kind of low-grade fever or whatever, then do retest. So when you do that frequently enough, then you have the level of comfort knowing that you've done the best you can for your family and your child. Then you can ease yourself in that environment, and then she can get some help, and at the same time, she can ease herself into dealing with more open society, right?
Yeah, and it sounds like maybe there's a fear component. I think there's a lot of fear that was, we've taken on a lot of fear based on what we've heard in the media. So maybe some of it's getting over some of the fear that we've taken on. As well,
and I think that's a big problem in life is that there's only two driving factors for a lot of things in life. One is fear, which we see rampant during the pandemic. Of course, the other one is greed. So people do things because they're greedy about whatever. So I think the things to do is to address that. But the important thing is to address it. So if you fearful about getting infection, well, do the frequent testing. If you're fearful about something else, well, then wear the mask or wash your hand or whatever. But you really need to put it there. The thing that I don't want people or the family members or friends tell them that, well, don't worry about it. It's like, are you serious? If it's in your mind and you worry about it, you need to address it. I don't care how irrational it might be, you need to address it, because if you don't, you're going to still wondering about those potential, and when it does happen, it might not happen, but when whatever the negative impact that happened, you're going to be kicking yourself because I was going to worry about that. Now I get stuck with COVID or whatever the condition that I have, right? So that's why it's important to address those fears, to put the safeguards in place.
So kind of honoring your own experience and being true to yourself, like you mentioned before. Okay, great. And if somebody were to tell you, I've had anxiety and depression for a while now, and I don't like it, but I'm comfortable with it, if you know what I mean, how do I break free from that kind of pattern?
Yeah, and I think that's a typical situation. People actually come from a tough neighborhood. They love to hang out in the neighborhood. They can't stand it, but they like to hang out because people understand their language and how they feel and that kind of thing. So I think the first thing is to recognize it. So once you recognize part one, then part two is continue to make incremental changing. And I think first you need to set a goal. So if your goal is, okay, well, I wanted to feel healthy and normal and basically liberated from these kind of change, then you do that. So just a simple things to say to yourself every single day. For example, I'm thankful I'm getting better. I'm thankful I'm free from anxiety, depression. And you say that before you go to sleep, first thing in the morning, throughout the day. So then you need to convince yourself, because a lot of these people, they already so much pre-programmed throughout their life experience, or even dealing with their family members. They only know one thing. Yeah. They just stuck in there, and they'll never get better because it's passed on from generation to generations. Yeah. And the second part is that they need to remind themselves, well, if you found yourself in hell, you know how to get out of hell? Just walk a little faster, one foot in front of the other one. Just keep walking. Do not linger around and hang out, because when you linger and you hang out, well, then no wonder you just go around the circle all the time. So just plot the course of action and just keep walking, and then use friends and support system that you have to kind of help you to continue with that journey. It's not easy, but it's going to take some time, and it starts with step number one. And if you don't do it, you're just stuck, and no wonder you are.
Yeah, so it sounds like it's getting in the practice of changing our thought patterns by having those thoughts that we talked about.
And
projecting.
exactly. And I think so then, we talk about how do you accomplish a lot of things in life. Of course, we talk about stay, physically healthy, mentally strong. But I think the third component, which I think is extremely important, is spiritually strong. Because if you're spiritually connected, then you are more likely to take that leap of faith. Because the unknown is like a big old drop, and then how are you going to get out of this terrible situation? Well, there's a big old dark hole right there. So you're so scared you wouldn't dare take the step. So when you have that spiritual connection, then you take the leap of faith. You know that you'll be fine. And the funny thing is, once you actually go through that journey, like, oh my God, how come I just locked myself in there? How come I didn't just do that step 20 years ago? And I think that's really important to kind of have that connection so that you can take the next level that has so much unknown.
Yeah, I think that's such a great word, connection, because I think often with anxiety and depression, often it seems to be that lack of connection that is part of the presenting issue. Okay, great. And I noticed that you don't have any prepared notes when you're talking to me, and a lot of other people come in and they have lectures that are already prepared. Can you share a little bit about why that is?
Yeah, so I think in general, for me, it's all about just saying the true you. We're talking about having the true you. So the only person that can be is me, myself. So everything that I tell you or other patients I talk to and other people that I interact with, coming from my heart. So, well, what's there? There's no script. Just kind of say it the way it is. And then the second question people always ask is, well, how do I know what to say? And I think it's always hard. Well, how do you know what to say? And the answer is, it all depends on, I call heart-to-heart connection. So I discuss with you, my heart is open, your heart is open, we have the connection. So I know what to say, when to say, at the right place, at the right time. And sometimes, a lot of time, I can't predict that, especially with patient care, because it all depends on the individual's need. And so then when you have that, then it come out very organic and very real and very relevant. And I think that's really the important thing. And there's no topic that is off topic. So therefore, I was like, okay, whatever come up, I tell them. And sometimes it might sound kind of off the wall, doesn't sound very real, like how could a doctor actually say this? Doesn't matter for me because that's a real me. So of course, there's only one way for me to present is me, myself, in a truest form without any filter, right?
So it sounds like you're really helping people explore how to get back in touch with themselves again, because when they do that, they can become that best doctor for themselves and get back in touch with their own intuition. So it seems like you have a great new approach to really guiding people to finding that within themselves so they can work on healing and maintaining their own health.
Right. And I think that's really truly the whole secret about that is that I look at myself like a coach. I help them to kind of see where things are. I show a little flashlight so they know where to go when they get lost in the forest, for example. And then they do it themselves. And I'm like the best cheerleader for them. And each time they go, then I feel, oh, wow, that's really cool. So whether they get better with anxiety, depression, healing from sexual abuse or mental abuse, or losing 80, 100 pounds, whatever that is, like, oh, wow, I'm so glad that you're doing that. And then the goal for all of the patient is one and the same. Well, the less you see me as the patient, the better, because that means you're doing good. And so they're going to feel the sense of accomplishment that they done it all, and I don't need the coach anymore. And that's when I successfully achieve that goal. And that goes back to the whole hospital system that we talked about, is that what are we doing with the hospital system? Well, right now we're literally encouraging sickness and not health, right? So the more people go to the ER, the more people go to the hospital, the better, and more procedures, better. Well, that drains financially for the system, but also it has a lot of cost, untold cost on human being and people in the community. So the way to do it is really simple. Well, just focus on that. Keep people healthier so then that way they don't have to go through these kind of suffering situations, and then they'll be able to get better and be more proactive. So, for example, if they realize they get anxiety, depression, well, guess what? Address it early on instead of waiting until they start killing themselves or they, gain 50 pounds and then get even more of those symptoms. So all of that is such a small steps, but they actually have a significant improvement and return of investment in terms of much healthier, happier population. I think that's really the important thing.
So it's almost like you're trying to turn it more into a wellness system than a sickness system, which
Right.
is great because you're teaching people how to be well, which is sort
Right.
of a refreshing new approach in this day and age.
Yeah,
So-
and that's it. And I think it's kind of funny because so many people say, well, for example, I have patients say, well, I already see 5, 10 doctors, all the specialists from Stanford and UCSF, they come here see Dr. Q. What are you going to do for me? And they literally come in, they ask me, what are you going to do for me? What are you going to give me? I said, nothing. I was like, are you serious? Like nothing? Like what? You already get all the medication, the book, you already get all the treatment in the book. You're not getting better. What do you think? What I'm going to give you is going to get you better. But we're going to do this. Stop everything, take a step backward, reevaluate the situation. And at the end of the day, most of these medical conditions that they come in with have a common denominator. We just need to trace it all the way back. And it could be 5 years, 10 years, 20 years, even 30 years or more. The point is that once you actually trace back to the origin of the problem, then all of a sudden solution becomes so much easier. But people never bother to go that far because, well, it takes too much time. Doctors don't have enough time in the day for the clinic to see the patient. Well, it's not that. I mean, I spend the same amount of time as regular doctors do, but it's not the time, it's the quality of time. So I might walk out of the room 10 minutes later, feel like I got this much amount of information covered, whereas other people say, wow, my God, I don't even know a patient, I don't even remember them. But once you have that connection, it's actually phenomenal, and the connection is going to lend to knowledge, the inside knowledge of the patient. So then I walk into a room seeing the patient, even though I've seen them 2 or 3 times. It's like, how come you don't look well? And I think that's important because once you actually can detect that, then the patient is going to be able to be more likely to bring up whatever things that actually bothers them. But if it's just coming, oh, well, here's this and that medication, okay, get out of here. Sure, you can do that, but anyone can do that. You can look up Google, you can do that. So why you even need me for, right? So, don't even bother with that. You need to have a lot more investigation. So the treatment is going to be a whole lot more effective.
Yeah, so it sounds like you're building a relationship with your patients, which then breeds trust and then helps them to get to a place where they can help discover how to become well versus it's a more of a, instead of putting a Band-Aid on, let's actually heal the wound.
Right, and I think that's really important. I tell a lot of my patients, this is that every single visit, it's just like a TV sitcom. We want to see episode 1, 2, 3, 4, 5, season 1, season 2, season 3, right? Don't just go and just season 1, episode 1 every single time.
Right.
Well, it's just frustrating. No wonder a lot of these patients can't stand it. They don't get better. They always have the same conversation. And how many times you see patients say, well, all of my information on the record, how come you don't know anything about it, right? So the doctor or the nurse practitioner or the PA are like, oh, wow, I didn't know, whatever. Well, just if you stuck at episode 1, season 1 all the time, you never get anywhere. You need to go to season 1 to season 5 or 10 or whatever. And then you end the whole series, and that'd be great because then that means that you're well. You don't have to go through that traumatic situations anymore.
Yeah, it sounds like as you're getting to know them, you're helping them to get to know themselves as well, which is part of the healing process.
Absolutely.
Okay. And I don't know how we're doing for time, but I don't know if we wanted to open up to any questions to people sitting around the table here.
All right. Well, everyone is all well versed on anxiety, depression. Then you're gonna go. I'm gonna expect you guys to go out there and do a whole seminar of how to help friends and family not to get anxious, not to get depressed, and that kind of thing. And that's a good thing. All right.
People with anxiety and depression, they have a lot of a sleep problem. What's your kind of advice for them that they can't fall asleep because they're thinking so much, their brain kind of going everywhere? What do you think?
Yeah.
So I'll repeat the question for you just so that on the camera they can hear it on the recording. So for people who are having trouble with sleep, what would be your recommendation for how to get the mind to slow down so they can fall asleep?
So number one part is sleep is so important because if you lack a sleep, then your anxiety, depression is going to be a whole lot worse. I mean, how many times, especially as a mom, just have babies and stuff like that, they just get anxious all the time because of the fact they don't have enough sleep. I call the effects like a walking zombie. It's like just a walking zombie all the time. How are you going to get better? So you need your sleep. So the important thing is to find a way to do that. Usually, most of the time, you need to do some activity to calm your nerve down. So I call the effects of recharging your battery, just like a cell phone we all have. When you use up all of that energy and resources, you're blinking red all the time. So when you're blinking red and you don't recharge your battery, then you never get better. So you constantly playing catch up. So then that gives us to the me time. So you're going to have the me time to get better. So you need to discover what is it that actually brings joy and blissfulness to your life, because then when you do more of that, then you actually regain some of that. So that's part one. Part two is that you whatever the supplement that friends and family recommend, try that first. And then part three is to have a healthy diet. Because what happened is that if you hear about little kids having sugar high, well, just imagine, before you go to sleep, you drink a beer and then you top it up with, ice cream and cookie. Well, no wonder you're going to have sugar high all night long. That's going to help you. So then just, you need to not having that. So you're not going to have so much swing of the carbohydrate in your system, so then your system can calm down. And then number three is, of course, some of the routine is important. Once you have a routine, your body doesn't have to think so much, so you don't have to use a lot of brain power. So when you have your routine, what do you do at noontime, at evening time? Once you have the routine, your body is going to get better, and then it's going to calm down. And of course, there's going to be time you need a little extra help with medication or supplement, then do that. But again, ask the three questions. Why am I taking it? How long do I take it for when I get off of it? What do I do? What is my game plan to get off of it, right? So
I really love that, because you don't really hear that much as far as a game plan for how to getting off of medication.
Right.
So that's a great, refreshing approach. Any other questions that are kind of pressing for people?
As a candidate for the board of directors and your business experience, you've been talking about your medical experience. What will you bring to the board of directors that is new to the board of directors?
Yeah, I think it's a very relevant question. What am I going to do differently? And I think the answer is really simple. We're going to approach it differently. Why? Right now, a lot of the boards, I don't know if any of you actually look at the board package, whether SDMH or CHOP or any other organization, same thing, yay thick. And it has so much information in there. You can have 3 business degrees and you still have a hard time going through, even if you spent the full time to do that. Well, most of us going to have work, and then this is a volunteer position. So the things to do is you need to have enough teamwork in order to help that. Everyone at that table, at the board level, are paid, except for the board of directors. So guess what? We're going to have the resources in the hospital to have a paid position, executive assistants, for that one board member or 2 board member, and that person is going to spend their job is to make sure to process all of that, distill the information, and give it to the board member. So instead of being a puppet and rubber stamp, just say whatever, agree to whatever the proposal is, you actually is going to govern with clarity and wisdom. I think that's really the important thing. So then everybody is going to govern with clarity and wisdom, and then we really stay true to our mission, which is have the community hospital, which uses taxpayers' money for the community and keep all of us healthy instead of having all of these stuff. So for one of the examples I have is that people go to a lot of hospital locally and they have 2 heart attacks. What does that mean by 2 heart attacks? They come in for the heart attack, they stay for whatever the time, get the cardiac surgery and all that stuff, and then they get home, they get a little bit better, and guess what? They get the bill coming and they open the letters and oh my God, my second heart attack, because the bill is like a couple $100,000 or even more. They literally go bankrupt. What good is that going to do when you get 2 heart attacks back to back, figuratively speaking, of course? But I think it's just wrong. If you really have the hospital to serve for the community, for the people in the community, you need to address that. It's just unfathomable that you actually do that to people in the community. So therefore, we'll keep them healthy, less the bills and that kind of thing. Yeah. All righty then. Well, thank you very much for having this conversation, and we're looking forward to the next discussion. Again, working together to help one another and to have a healthier and happier lives, right?
Yeah, thank you so much, Dr. Q. We really appreciate you taking your time, spending it with us to learn more about you and spend time with the audience and addressing questions that you've heard in your clinic. We're really thankful to know that you're looking to have the leadership there at SBMH with the board of directors, and that will help guide our community in a brand new direction that really is supporting of the people in the community, and that's great to see. We're really excited.
Thank you, Laurie.
Thank you so
Okay,
much.
have a good night, ma'am.
Thanks, you too.
All right, bye.
Thank you.